But first, we're celebrating first responders. Yeah, it's National Nurses Week, and New Yorkers are honoring first responders who have been through a lot these last 3 years. Thousands put their lives on the line during the pandemic, and now that COVID infections are way down, many are dealing with another major issue: the city's mental health crisis. Let's talk about it now with Latisha Hanson, Assistant Professor at Columbia University School of Nursing, and Michelle Charles, a nursing student. Ladies, thank you both for being here. And Professor, I want to start with you. You're also a psychiatric mental health nurse practitioner. Give us some insight about the city's mental health crisis right now. It seems to be spiraling out of control. What are your thoughts on that?
Well, first, I just wanted to say thank you so much for shining a light on mental health awareness and also nursing. And we need to keep these conversations going. There's so much stigma surrounding mental wellness and mental illness. So having conversations like these are so important. I think that we also need to take time to think of our stress, think of how we're feeling, and we need to be proactive rather than reactive with responding to our mental health awareness. If we were proactive, we would be doing things like having mental health screenings rather than waiting until someone has depression or someone has bipolar disorder and then seeing what we're seeing now in the city.
Yeah, and we're seeing it. I mean, our top story was based on a homeless man who didn't get the help he needed, apparently. Ms. Charles, you are graduating with a degree in psychiatric mental health. What did you learn about holistic treatments? Because that is a very important topic now.
Sure. So I learned that it's really important to attend to the whole person and to tailor our treatments in a way that that's going to meet the patient where they are. And so one of my favorite ways to work right now is in a program called Assertive Community Treatment, where we actually go out into the communities and we, visit clients at their homes, take them to grab a cup of coffee, and we talk about their medications right then and there. So we just make it super, super accessible to them, and we make sure that mental health care fits in the context of their lives.
Yeah, accessibility is a key issue. Professor, you mentioned this briefly, the stigma associated with mental health. There's a growing movement to address it in schools and houses of worship and barbershops and salons. What do you make of that?
I think that would normalize mental wellness by being able to work in the community. And with my students as well, I teach them, they're the future generation, students like Michelle here, that's so passionate about working with our patients and the population that we deal with. And I teach them that they also have to worry, and they also have to maintain their own self-care. They have to do things to normalize mental wellness, like exercise, eating well, sleeping. We tend to make excuses. So we may say, like, I don't have the right gym clothes, or I don't have a gym membership, or we put all these obstacles in the way. But it could be something as simple as just getting off the bus and stop early, or getting off the train and stop early. So doing things to make mental health part of our everyday lives.
Ms. Charles, I want to end with you. I have about 30 seconds. You're a young person, you're graduating, and rates of anxiety and depression really increased among young people. What have you learned about that?
I've learned that, so those rates are increasing, but I also think that the conversations are increasing, right? So with my younger clients, they are talking so freely and so vulnerably about mental health and, mental wellness. And I think that, that's so commendable, right? Like they're doing away with that stigma. And, I think that only bodes well for folks getting the access to the care that they need.
With Michelle Charles, thank you, and Professor Latisha Hanson of Columbia Nursing School. We appreciate you, and congrats to the class of 2023.
Thank you.